The thyroid is a tiny itty-bitty organ. It has to be. It's located in a narrow part of our body, right here at the base of our neck. It's a 2-inch long butterfly-shaped gland weighing less than 1 ounce. Such a tiny organ, and yet it's in charge of some big jobs. The thyroid produces several hormones that direct important functions like metabolism, heart rate, growth, and temperature. When the thyroid can't keep up with hormone production, a person develops a condition called hypothyroidism. There are several reasons why someone may develop hypothyroidism, but today we're going to talk about the number one reason.
In America, the most common reason is something called Hashimoto's thyroiditis, simply named after a man named Dr. Hashimoto from Japan. And what this says is that the body is making antibodies against the thyroid. We're supposed to make antibodies to fight bacteria, to fight viruses, and every now and then the body will make what's called an autoantibody, which means it fights itself. As a result of that, it doesn't let the thyroid gland do its job properly, and that's when the gland may become underactive.
Hashimoto's thyroiditis can be detected by doing a blood test, either looking for antibodies or measuring the hormone levels. Unfortunately, Hashimoto's thyroiditis progresses slowly over many years, and there may not be any symptoms at all. You might notice there's something wrong if you develop the symptoms of an underactive thyroid.
The common symptoms of an underactive thyroid are extremely general. So I have many patients walk into the room and look at the list of thyroid hormones and say, that's me. I have fatigue, I have weight gain, I'm colder, I have constipation. These are all very, very common symptoms of an underactive thyroid.
Given the non-specific symptoms, Hashimoto's thyroiditis is often misdiagnosed as depression, PMS, chronic fatigue syndrome, or fibromyalgia. The first obvious sign then, the one you can't explain as being stressed from work or just getting old, is often an enlarged thyroid called a goiter.
When there is an underactive thyroid, for various reasons, the thyroid gland does not make as much thyroid hormone as it should, and the pituitary gland generally revs up and tells the thyroid to try and make more. Sometimes it works and sometimes it doesn't, and sometimes the gland grows just in an attempt to try to make more thyroid hormone.
Once detected, treatment should begin immediately. If untreated for an extended period, Hashimoto's thyroiditis may lead to muscle failure, including possible heart failure. Treatment may be as simple as taking a tablet once a day.
We generally treat these patients with thyroid hormone. There are 13 different doses of thyroid hormone, so we tend to get it pretty good, exact for the individual patient. And we use the pituitary thermostat as our best way to guide ourselves. Are we doing a good job in terms of the dosing?
You can't prevent Hashimoto's thyroiditis, but if you know your risk factors, then you can be vigilant about vague symptoms and seeking treatment. It's 7 times more common in women than men. It runs in families, and it's most prevalent between 30 and 50 years of age. People with other autoimmune diseases are more likely to develop Hashimoto's thyroiditis. If you have those risk factors, keep an eye on that tiny thyroid by talking with your doctor. I'm Dr. Mike Rosen, and you're watching the eHealth Network. Stay healthy.